One of the important chapter, that is pharmacology of drugs acting on peripheral nervous system. There you know neurohumoral transmission, co-transmission, and neurotransmitter. And one of the topic like sympathomimetic drug and parasympathomimetic drug. But here I will discuss about parasympathomimetic drugs. Here you have to know the different receptors of parasympathomimetic drugs and pharmacology of drugs and pharmacological classification of parasympathomimetic drug. You know neurotransmission or neurohumoral transmission steps. First of all, synthesis of neurotransmitter, uptake of neurotransmitter or release of neurotransmitter, and binding to the receptor, and then degradation of that receptor and recycling. But here neurotransmission at cholinergic neurons. Here also same steps. First step is synthesis of acetylcholine, as because acetylcholine is the important neurotransmitter in cholinergic nervous system. So first of all, synthesis of acetylcholine, it will synthesized from choline and acetyl-CoA. After synthesis, this acetylcholine will uptake to the storage vesicle. In third, release of neurotransmitter, then that neurotransmitter acetylcholine will be released to the presynaptic nerve, not synaptic cleft. After that, binding of the receptors. That receptors which is released to the synaptic cleft, that binds with the receptors which is present in postsynaptic nerve ending. In fifth step, degradation of acetylcholine. That some parts of acetylcholine present in synaptic cleft, which will degrade with the help of enzyme acetylcholinesterase. And last, recycling of choline. The degraded acetylcholine into choline, that will be taken up by the nerve ending, pre-synaptic nerve ending again. And this is the cycle. It will be continuous. It is continuous cycle. You have to know the acetylcholinesterase enzyme. What is the function of acetylcholinesterase enzyme? And this acetylcholinesterase enzyme will break acetylcholine into acetyl-CoA and acetate. After that, everyone knows what is the difference between sympathetic and parasympathetic nervous system or nerves. In eye, you can see in parasympathetic nerves cause constriction of pupil, but in sympathetic it cause dilation of pupil. In heart, parasympathetic decrease heart rate and force of contraction, but in sympathetic it increase heart rate and force of contraction. In lungs, sympathetic cause bronchodilation, but parasympathetic cause bronchoconstriction. In GIT, sympathetic cause decrease motility and secretion, and in parasympathetic it increase motility and secretions. In blood vessel, sympathetic cause vasoconstriction, but parasympathetic cause vasodilation. Again, different types of receptor is there. In parasympathomimetic drugs, there will be mainly two types of receptor is present. One is muscarinic receptor, another is nicotinic receptor. In muscarinic receptor, three types of receptor, M1, M2 and M3. And you have to know the exact location of receptor. That is, M1 receptor is present in CNS, M2 receptor is present in heart, and M3 receptor is present in smooth muscle. It is the specific area where this receptor is located. And next, you have to know the functions of these receptors. That is, M1 receptor increase gastric acid secretion, increase GI motility, but in M2 receptor, which is present in heart, cause or decrease heart rate or cause bradycardia and contractility. And M3 receptor, which is present in smooth muscle, cause smooth muscle contraction. And again, in mechanism, you can see M1 receptor acts through IP3 DAX pathway, M2 receptor decrease or inhibit formation cyclic AMP, and M3 receptor have same mechanism of action like M1 receptor. And you can see here agonist. M1 receptor agonist is oxotrimorin, M2 receptor agonist is methacholine, and M3 receptor agonist is bethanechol. And again antagonist here, pyrazipine and talenzipine is the M1 receptor antagonist, and tryptamine is the M2 receptor antagonist, and toltarodine is the M3 receptor antagonist. This chart is important, you can remember this. It is very important for. Then nicotinic, here nicotinic receptor is there. Two types of nicotinic receptor, NM receptor, NN receptor. NM neuromuscular receptor, which is present in neuromuscular junction, and NN receptor is the autonomic ganglia. They are present in autonomic ganglia, adrenal medulla, and CNS. Function is different. NM receptor cause depolarization of motor and plate contraction of skeletal muscle. And here NN receptor also cause depolarization and post-ganglionic impulse. In adrenal medulla cause catecholamine release, but in CNS cause excitation or inhibition. Here agonist and antagonist you have to remember. NM receptor agonist is nicotine and antagonist is tibocurarine. NN receptor agonist is nicotine and DMPP, but antagonist is hexamethonium and trimethophan. Next, from here cholinergic drug is start. This cholinergic drug also known as cholinomimetics drug and parasympathomimetic drugs, and you know the definition of these. And here these are the drugs which produce action similar to that of acetylcholine. That means these are the agonists which will mimic the activity of in the pharmacological classification of parasympathomimetic drugs, you have to remember this. And here two types of drug is there, cholinesters and alkaloids. Cholinergic drug agonists these are. And here cholinesters include acetylcholine, methacholine, carbachol, bethanechol, and alkaloids includes muscarine, pilocarpines, and arecholine. You have to remember this class of anticholinesterase drug, that means acetylcholinesterase inhibitors, which are responsible for acetylcholinesterase. These are the drugs which break down acetylcholine. Here antagonist is used, that means acetylcholinesterase inhibitors or anticholinesterase drug that are reversible and irreversible. In reversible, physostigmine, neostigmine, adrophonium, rivastigmine, and donepezil is there. In irreversible, ecotiophate, malathion, carbamase. These are the drugs. Again, different types of receptor is there. In parasympathomimetic drugs, there will be mainly two types of receptor is present. One is muscarinic receptor, another is nicotinic receptor. In muscarinic receptor, three types of receptor, M1, M2, and M3. And you have to know the exact location of receptor. That is, M1 receptor is present in CNS, M2 receptor is present in heart, and here you can see the pharmacological action of acetylcholine. Acetylcholine decrease heart rate and cardiac output, decrease blood pressure, as because acetylcholine have muscarinic and nicotinic activity, and M3 receptor is present in smooth muscle, and due to the stimulation of this smooth muscle, there will be production of nitric oxide, and which is responsible for smooth muscle relaxation. Neurotransmission or neurohumoral transmission steps. First of all, synthesis of neurotransmitter, uptake of neurotransmitter or release of neurotransmitter, and binding to the receptor, and then degradation of the second drug. Bethanechol is one of the drug. Here 2-3 important MCQs may be asked in bethanechol. That means bethanechol is not hydrolyzed by acetylcholinesterase. Why? Because in bethanechol carbonic acid is present, that's why it is not hydrolyzed by acetylcholinesterase. And it also, why bethanechol is does not have muscarinic activity, because in bethanechol methyl group is added, that's why. This is the two important MCQs they may ask. One is why bethanecol is not hydrolyzed by acetylcholinesterase. Another is why bethanecol does not have muscarinic activity. Action of bethanecol, that means bethanecol stimulate muscarinic receptors, and it also stimulates the dorsal muscle of the bladder. It increases intestinal motility and tone. Then use of bethanecol, mainly bethanecol is used in urogenic treatment or used in the treatment of megacolon, which cause hypertrophy and dilation of the colon. And some of the side effects of bethanecol are salivation, flushing, sweating, nausea, abdominal pain, diarrhea, bronchospasm, decreased blood pressure. Carbachol, here also carbachol is like bethanecol, or carbachol also does not have nicotinic action because the methyl group is absent here. But in carbachol also not hydrolyzed by acetylcholinesterase like bethanecol. The carbachol is used in the treatment of glaucoma, and there is no side effects of carbachol as because there is no systemic penetration if you are taking carbachol. Next, from here cholinergic drug is start. This cholinergic drug, also known as cholinomimetics drug and parasympathomimetic drugs, and you know the definition of these. And here these are the drugs. You can see the actions of carbachol. Pilocarpine also used to cause meiosis, that means used in the treatment of glaucoma. Or ecothiopate is one of the irreversible anticholinesterase. You have to remember the mechanism of action of this, and main mechanism of action of ecothiopate, that means this ecothiopate binds with the phosphate group to the serine OH group at the active site of acetylcholinesterase. You have to remember the site where this ecothiopate is binded. Ecothiopate is bind to the serine OH group at the active site of acetylcholinesterase. This acetylcholinesterase have two sites. One is serine site, another is acetyl site, ester site. This in serine part, ecothiopate will be bind by and this will bind covalently. Okay. That's all about parasympathomimetic drug, and next I will discuss parasympatholytic drugs. Thank you.